fancy words up here. I think, yeah, centralization and peripheralization. I don't particularly expect for you to understand what that means. But effectively, if I kind of break it down for you so it is easier to understand, say I tend to lean over to this side, which means probably my left side is going to be irritable. Okay? So if I do a side bend and I'm encouraging pain, that's shooting down my bum and into my leg, that's called peripheralization. My pain is going peripherally. We don't want that to happen. We don't want to encourage that pain. Okay? What we do want to happen is for it to come back to the middle or dissipate completely. So in our assessments, we'll always have 2 or 3 movements where someone's pain-free. Okay? It's usually the opposite. So if their pain is on bending to the side, as in closing their joint space down, they're probably going to be less painful going to the opposite side and opening it up. So that would be a movement for us for sure. And then they say, well, why would I just bend to the right? Why don't I bend to the left? It doesn't matter. That's the great thing. You're moving. By moving, you're creating an influx of water that goes into the disc, and then the disc goes, and I'm exaggerating, and it gives you that much space to be able to move again. Also, by moving, you have blood flow. How many of you are stiff in the morning? I am, for sure. Why? Blood drops down. You get up, you move around, oh yeah, I feel a little bit better now. Blood back into the area. So we need to move. Blood helps us move, it warms the area, and it has healing properties. So we want to move away from pain that causes pain shooting anywhere. Okay? If your pain is only in the middle, great, fantastic. That means you get to do all of our exercises that we give you instead of just a few. Okay? And of course, we base those movements on our assessment findings. So it gets a bit tricky, again, if we're talking to the normal general public and saying, yeah, just do an exercise that doesn't cause pain going down your leg. It's not viable. Okay, there's a little bit more to it than that. But again, generally speaking, this is what we're looking for in our assessment processes. Okay? And then it's constantly reviewed. You get in, you're feeling better. Okay, well, let's add that one in now. Oh, you're better again. Let's do core stability. Let's do pelvic control. Yeah, so it's a progressive thing. Okay? And by not encouraging pain, you're tricking your brain to think that you can move without pain. If all you're doing is going ding, 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 pain, 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 your brain is going to be like, yeah, if I move my back, I'm in pain. I don't want to move. But if we go over here, oh yeah, that feels really good. The brain starts going, yeah, you can move that back. There isn't as much pain as you thought. And then that helps with our emotional baggage. Yeah, the stuff that our stories that are telling ourselves about pain. Oh, I can't move my back. Okay. One thing that I did not talk about with regards to emotions, and I'm going to digress back to that chronic pain slide, is our mood. Right at the beginning, I said our moods affect our pain. Okay, and I forgot to touch on that, but while it's just popped into my head when we're talking about it, when we're anxious, stressed, sad, I mean, all of those emotions that we would probably put in a more negative box. What tends to happen chemically is we release something called cortisol. Okay? Don't worry about cortisol or what it means. Okay? Basically, what it does is it makes us feel more sad and it makes us feel more pain. Okay? So if we're in that cycle, and how many people do it? I'm in pain, I'm just going to live with it. I'm not going to do anything about it. How are you going to get out of that box? But then we have this other group of people over here who are experiencing the same symptoms initially, but they're proactive, they're doing something, exercise. All these things. It starts to change your chemical makeup. And then you start to get control. You have empowerment. And that's this proactive state. The back of steel. This is awesome. I don't know if anyone's ever tried that. They did some research to suggest that posture has an immediate response on how you feel. And if you can make yourself feel better immediately, then again, you're going to have a positive impact on that chemical makeup. Okay? So the research really was, they had 2 groups. One group went into a room and looked at themselves in a mirror like this. And they walked away feeling down in the dumps. And then they had another group do something like that. and instantly felt better. They even tested chemicals as well. They took blood. Okay? Instant change. And the great thing about it is you don't even have to be happy for real. You don't have to have won a race. You don't have to have won the lottery. You can just fist pump whatever you want. And it's going to have an immediate response on how you feel. It's fantastic. Honestly, try it tonight when you go home. Don't do it before you go to bed, though. You'll be up all night. And then that's going to have a response on our chemical balance. And then this goes back to us with exercise and doing something about it. We start achieving goals. That's empowerment in itself. I think a lot of our clients want, when they come in, particularly, I'll use a more active person. Say they're a keen runner, they have back pain, and I tell them they can't run. All they want to know is when they can run again. They don't want to know about the B, the C, the D, and the E, and the F that go before running. It's progressive. So it's more important for us to actually make those short-term goals that we can focus on. Because actually, if I really like to run and I'm not running, I'm depressed. So if all you're thinking about is, I can't run, man, I hate life, you're going to hate life. But if we're focusing on these little goals that we're putting in place, it changes your mindset. You're achieving something. You write them down, you tick them off, next. It's really, really empowering. Deep breathing. I would say, again, the majority of us don't know how to breathe. Majority of us breathe from here. If you took a deep breath right now, I would probably bet all of my bank account that the majority of you would lift from here as opposed to breathe from here. It's called diaphragm breathing. It's massively important. If you don't know how to breathe right, I suggest that's a really good place for you to start. Make that one of your first goals. Why? Solar plexus, bundle of nerves in your midsection. Diaphragm breathing, you wake that up. Energy, feel-good factor, organs inside, rubbing them, feel-good factor. Outside of the fact, as I put on the board here, if you breathe more deeply, you take more oxygen. If we're breathing more effectively, we get more oxygen. We breathe less, and we take more in with one breath, which means that we're getting oxygen to our painful areas and helping them feel better. Really simple. And then doing all those exercises that we've discussed, obviously they're going to increase our strength, our mobility, and our flexibility. Okay? And that's pretty much what I've got. Okay? So, I think probably now, if anyone has any questions, would be a great time to throw it up. And I'll do my best to answer it in a way that hopefully everyone will understand. But don't be afraid, because the whole point of you coming here tonight is to learn a little bit more about how you can take control. I know I haven't put anything specific about back exercises here. The only reason why is because some of you I've already treated, so you should be doing some things anyway. And then the others that I haven't treated, I wouldn't want to give you something that is going to make you painful. Does anyone have any questions?
Touching back on the sciaticas then.
Yes.
If a doctor tells you you've got sciatica, where do you go next with that? You know what I mean? Because you put your trust in the doctor, don't you, at the end of the day?
Yeah.
So if he says it's sciatica and I'm not going to do anything for you, just take medication for it,
yeah.
Where do you turn next?
That's a good question, and I think, some kind of therapy, whether it's sports therapy or physio or chiropractic or osteopath, whatever therapy you maybe used before, or I'd hate to differentiate between therapies, because to me, all of those therapies, if they're good at what they do, there's so much gray line.
Yeah.
You know, a chiropractor is known for manipulating joints, but as a physio, I can manipulate joints. You know, as a physio, we're known for a lot of rehab, but I know great chiropractors who do really good at rehab too. So it's not a definitive, what do I choose from a therapy point of view. It's more of a, what do I feel comfortable going to. Let me describe GPs. It's in their title. They're general practitioners. Their book is this thick, and they've got half a page on each thing. Physios, chiropractors, osteopaths, that's what we do. We see people every day in that category. So we have one book, but it's the same thickness. Now, it gets confusing again, because obviously I'm aware we have socialized medicine here in the UK. So a lot of us rely on going to the GP and then getting that physio referral. Well, let's go back to the acute, subacute, chronic pain. Do you want to wait 3 months to be treated? And now you're in a chronic pain category. You've got chemical imbalances, emotional imbalances, and physiological imbalances. I'm not saying it's too late, because I think that's quite harsh. But I wouldn't want to get to that point. So I think probably the best thing, what I would like to challenge a general practitioner to do, is give people options. So it would be, you've got sciatica. You can A, take medication, see what happens, come back to me later. B, I could maybe perhaps go see a physio or a chiropractor. You're going to have to pay for it. Because if I refer you to physio, it could take 3 months. Just a little bit of education. And then people can make that informed decision. They can either get upset about the fact that they have to wait 3 months for NHS and wait, or they can go to a private place and pay money because their health's important to them.
I think, I get a lot of people with sciatica because GPs are starting to say, well, you could just go and do Pilates. So they are starting to say, and then they'll either come to me and their symptoms get better, or if they don't, then I'll refer on to any of the other manual therapies like Joel said. So for me, I think I'm quite often a first point of call for sciatic people, because if a doctor does say you may need some treatment but you're going to wait a while, they can access a Pilates class much quicker than they might get their NHS physio, for example. A lot of people initially don't want to pay for private, even though I'm always encouraging.
I wasn't given any of the options.
Go to treatment.
It was purely just a case of, you've got sciatica, does it stop you doing anything? No, not at the moment. Well, in that case, then I'm not prepared to do anything until it physically stops you doing stuff. Just take ibuprofen and paracetamol.
Yeah.
That was it. End of.
Yeah, it's unfortunate, right?
So,
But, again, I would say the majority of people we see are in that category. Does anybody have any other questions?
Yeah, Joel, can I just ask? I know you said obviously weight is an impact.
Yes.
It's obviously common sense. Is there anything specific in diet-wise
Yes.
that will help lower back pain?
Yes, good question.
Smoking and the weight.
Yeah, good questions. So water. Okay, so water, again, we talk about pH balance. So any foods that are more acidic, your meats, that type of fruit, okay, processed foods, are going to raise acidity in the body. And that's going to contribute to aches and pains. Your vegetables, your fruits, your water, these are all really good, simple, quick answers, really, to be general about it. The more vegetable and fruit we have in our diet, as well as water, the better we're actually going to feel. And it's just from a whole host of things. So we're talking about pH balance. What about phytonutrients, which is a pretty big word. I don't expect everyone to know that. But, fruit and vegetables have phytonutrients. They fight illness and disease. So not only are they helping with their aches and pains, they're also fighting colds, flus, cancer. It's a big statement, I know, but it is a reality. And diet is a thing that we tend to ignore. But the saying, you are what you eat, is definitely the case. And you don't know how you're going to feel. So you could be eating garbage all day, every day. That's what your body knows. It doesn't know any different. And it'll probably go into revulsion when you try and make some kind of dietary change. But when it starts getting used to that diet, there's no way it's going back. That's a good question. So my challenge to you, if, say, you're looking to change one thing, my challenge to you would be to try and get more fruit and veg in your diet. I don't want to go into the whole sugar thing, fruit versus veg and all that stuff, but they're both really good options. They're better options than other things that we can choose. Anybody else got any questions? Honestly, don't be embarrassed if you got anything. No? Okay. Yeah?
So from a therapist's point of view,
Yeah.
if someone came to you and said, I've got sciatica like my GP has said to me, would you, for like the emotional side of things, would you say you haven't got, or you just educate them, or would you sort of say, okay, that's fine, and then work from that point?
Yeah, good question. So again, you're right, this is more of a therapy question. It probably doesn't relate to some of the patients, but it's a great question nonetheless. I'm not inclined to give someone a definitive diagnosis. Sciatica, bulging disc, facet syndrome. How can I look in their body and definitively say, I must admit, when I first qualified, I got caught out a few times. I was a bit young and maybe naive and said, yeah, that's this. They go get their x-ray, their MRI, and not that at all, something completely different. So many things present the same way. You have to be careful. So the challenge would be, as a therapist, does it matter? Does it matter if it's sciatica, a lateral bulging disc, or facet joint pain? Because your treatment in rehab is pretty much going to be the exact same. Their progress from a rehab point of view, again, is going to be the exact same. The big problem is people want a diagnosis. They want specificity. They want a specific.
I think that's the pressure doctors are under as well. If you go to the doctor, you're told what's wrong.
Yeah.
So if you go to the doctor and he says, I'm not really sure, you don't want to go to the doctor anymore.
Absolutely.
So they have to tell you that you've got something. So sciatica covers a lot of bases.
Yeah.
So they can say you've got sciatica.
Absolutely.
See that.
And I think, again, going back to be general about what terms you're using. I usually in back pain software, I'll go through facet joint movement and disc movement. I'll say the joint space is irritated. They're happy with that. And then they go away, they come back, and they feel better. They're even happier. So yeah, just be careful not to jump the gun and give something a specific diagnosis. I think as sports therapists, I'm a sports therapist as well, because we're about pushing things away as opposed to holding one option. Yeah? Anything else? No? Okay, I really appreciate everybody coming out. And if you want to talk to me privately, please feel free to come on over. Hopefully all of you have at least taken a little bit away from that as to awareness and understanding of what you can kind of do to move forward with regards to your back and your overall health and well-being. Okay. And that's it. Thanks.